Most people are doing everything they were told. Taking their medication, cutting back on salt, maybe even watching what they eat. And their blood pressure is still not where it should be. If that sounds familiar, stay with me. What I'm about to share with you genuinely changed how my patients think about their own hearts. I've spent 30 years in cardiac surgery. I've opened chests, repaired arteries, and held beating hearts in my hands. What most people understand about blood pressure barely scratches the surface of what's actually happening inside their bodies. Today, I'm going to walk you through 5 natural supplements that work on mechanisms your medication is probably not touching at all. 5 different systems, 5 different weak points, and when you address all of them, something remarkable can happen. Let's get into it. Here's the first thing you need to understand. Medication works. I'm not here to tell you to throw your prescriptions away. ACE inhibitors, beta blockers, diuretics. These drugs save lives every single day, and I prescribe them. But what they do is manage your numbers. They don't replenish what your body is running low on. They don't calm the inflammation building up inside your arterial walls. They don't fix the energy deficit quietly, weakening your heart muscle. Think of it this way. If high blood pressure is a leaky roof, medication puts a bucket under the drip. What I want to talk about today is patching the actual hole. Let's start with magnesium. And I mean really start, because this mineral is mentioned everywhere, but almost nobody understands what it actually does. Magnesium functions as a natural calcium channel blocker inside your body. Magnesium tells the smooth muscle cells in your artery walls to relax, to open up, to let blood flow through with less resistance. The problem is that studies suggest up to 60% of adults over 60 are deficient in it, and most of them have no idea. Standard blood tests completely miss it. Only about 1% of your body's magnesium lives in your bloodstream. The rest is locked away in your cells and bones. So your lab results look perfectly fine while your arteries are running on empty. The form I recommend is magnesium glycinate, not the cheap oxide version that most drugstores sell. Glycinate absorbs. Well, it's gentle on your stomach, and the glycine it's bound to has a mild, calming effect on your nervous system. Start with around 120 milligrams before bed and work up gradually from there. And always, always talk to your doctor first, especially if you have any kidney issues. Now, let's talk about fish oil, because most people think of it as vaguely good for the heart and leave it at that. I want to give you the actual mechanism, because once you understand it, you'll never look at this supplement the same way again. Your arteries are not passive pipes, they're living tissue. And like any living tissue, they can become chronic low-grade inflammation in the arterial walls makes them stiffer, narrower, and far less able to expand and contract. Stiff, inflamed arteries mean higher pressure, full stop. Omega-3 fatty acids, specifically EPA, are among the most well-studied anti-inflammatory compounds we have. A 2022 analysis covering over 70 clinical trials found consistent, measurable reductions in blood pressure among adults with hypertension. One warning though, cheap fish oil that has been sitting on a warm shelf for months is largely oxidized. And oxidized oil can actually increase inflammation. Look for third-party tested products that contain at least 1 gram of combined EPA and DHA per serving. If it smells like a fishing dock, throw it out and get something better. Your arteries deserve that much. Third is CoQ10, and this one is close to my heart. Quite literally. CoQ10 is a compound your body produces naturally inside your mitochondria, the energy factories in every single cell. Your heart beats 100,000 times every day. That requires a continuous, enormous supply of energy. And CoQ10 is critical to producing it. When levels drop, your heart has to work harder to achieve the same output, and a strained, overworking heart drives blood pressure up. Here's the part that genuinely troubles me. Statins, the cholesterol medications that millions of people over 60 take daily, block the same biological pathway that produces CoQ10. So the very drug prescribed to protect your heart may be quietly draining the fuel your heart runs on. Several clinical trials have shown reductions of up to 17 points in systolic blood pressure with consistent CoQ10 supplementation that rivals some medications. Take between 100 and 200 milligrams daily with a meal that contains some fat, and give it at least 8 weeks. Fourth, and I want to be precise here, vitamin D is not actually a vitamin. It's a hormone, and it regulates one of the most important blood pressure control systems in your entire body, called the renin-angiotensin-aldosterone system. When vitamin D is adequate, that system runs calmly. When it's deficient, that system becomes overactive and pushes pressure up. Research involving over 300,000 participants found a direct, consistent link between low vitamin D and high blood pressure. And deficiency in adults over 60 is extraordinarily common, anywhere from 40 to 80% depending on the study. Before you supplement, get your blood levels tested. Take D3, not D2, and always pair it with vitamin K2, which helps direct calcium into your bones rather than letting it deposit in your arterial walls. Fifth is potassium, and the concept here is simple but powerful. Sodium tells your kidneys to hold on to fluid, which raises blood volume and pressure. Potassium tells your kidneys to do the exact opposite, to flush sodium out and reduce that volume. In most people eating a modern diet, sodium is winning that competition by a wide margin. Start with food. Avocados, sweet potatoes, white beans, spinach, salmon. Get your potassium from your plate. And if you do supplement, please have your kidney function checked first, because excess potassium can cause serious heart rhythm problems. Here's what I want you to walk away with today. Each of these 5 supplements alone produces a modest effect, but blood pressure is not driven by one mechanism. It's the result of 5 systems working at the same time. Vascular tension, inflammation, cellular energy, hormonal signaling, and fluid balance. When you support all 5 simultaneously, the combined effect becomes far greater than any single one could produce alone. That's not wishful thinking. That's biochemistry. This week, I want you to do one thing. Just one. Call your doctor and ask for a vitamin D test and a basic metabolic panel. 2 tests, 1 phone call. That's where you start. You've spent decades taking care of everyone else. It's time to take 30 minutes for your own heart. If this video helped you today, hit that like button, subscribe to BioWell Hub, and drop a comment below telling me which of these 5 you're most surprised by. I read every single one. I'll see you in the next video.